Retroactive jealousy. Really difficult, intrusive thoughts about our partner's sexual past. Feeling anxious, resentful, disgusted by what we know and reacting, asking for more details or pushing our partner away or obsessing about it for hours on end. Often it's a form of OCD, but not always. What if our emotional reaction is really intense, like a full-on panic attack or intense rage or emotional shutdown? I've worked with people having this kind of reaction to thoughts or reminders about their partner's past, and they've wondered, or someone suggested, that they might have BPD, borderline personality disorder. But what would that mean? Is diagnosis of BPD helpful? Maybe even essential for some people experiencing these symptoms? There's loads of information out there about BPD, and I'll put some links in the description. So I'll try to keep this really relevant to how BPD might show up as retroactive jealousy. Borderline personality disorder in a nutshell. A long-term pattern of significant interpersonal relationship instability, an acute fear of abandonment, and intense emotional outbursts. If you're wondering why that word borderline, yes, it's not the best of names. And it goes back to the 1960s. People were considered on the borderline between neurotic, anxious, nervous, and psychotic, getting confused about what's real and what isn't. Neurotic is an outdated term, but we can already start to see how retroactive jealousy can get borderline. Say, something about my partner's sexual past makes me uncomfortable. Like, she told me something she really enjoys in bed. Well, how did she find out that she enjoys it? Who did she make that discovery with? And she wants to do it with me. Is that so she can relive doing it with them? I don't think so, but now I'm thinking about it. I can picture her doing it with her exes, and they're having a great time. And I can feel my discomfort and my anger coming up. And I end up going through her phone to see if she ever sexted anyone about this, or I ask her out of the blue, did you enjoy that more with your exes? I'm doing things, saying things in reality to resolve a completely imagined dilemma. And it all starts to get a bit strange, because she says, what are you going on about? And I'm like, denial. So we can see how intense jealousy with compulsive checking could look a bit borderline in that old sense. But that's not what BPD actually is. A lot of people experiencing retroactive jealousy will relate to this loop of thinking and then acting irrationally. The worry feels real, and we act on it to get reassurance. Is this psychosis? No. We're confusing ourselves with our imagination. Is it on the borderline of psychosis? No, not usually. This type of confusion is very common in OCD, and it's still just OCD. So what might suggest borderline personality disorder? Another symptom is called splitting. People with BPD tend to alternate between idealizing their partner, putting them on a pedestal, and then devaluing them. You disgust me. Well, what does that sound like? Retroactive jealousy. When we're in the grip of thoughts and feelings, we can do a similar flip from I've never felt more loved to I can't believe I'm with someone who did that. So does that mean it's BPD? No, not necessarily. It's the emotional response to whatever story we're telling ourselves in the moment. Fear of abandonment, a big part of BPD, a core fear that our partner will leave us for someone better. Well, what does that sound like? Quite a lot like retroactive jealousy sometimes. And worries about our own self-worth too. What does my partner's past say about me and what will happen to me? With retroactive jealousy, our partner's past can get very tangled up with our own sense of self, our identity. Does it mean we have BPD? No. It means we have a wobbly sense of self, low confidence in ourselves perhaps. So if none of that stuff suggests BPD, what does? Well, the intensity of our distress might be the clue. For some people, their reaction to thoughts or triggers about their partner's past feels uncontrollable. If we find ourselves raging, screaming, trashing or breaking things that relate to the past, physically confronting our partner maybe, then we could be in BPD territory. Self-harming, substance abuse, or threats of suicide as a way to communicate the intensity of the distress, maybe. Sometimes when the behaviour is really controlling, That could indicate BPD. Demanding to go through a partner's phone, or showing up at exes' homes or workplaces. Big boundary violations. Retroactive jealousy and OCD can have us doing some pretty irrational things, but this is in a different league. Retroactive jealousy compulsions feel proportionate in the moment, even if we know we probably shouldn't do it. Asking, snooping, monitoring, to try to get more info, to try to get certainty, to feel better. We might not like the things we're doing, we might know that we're being irrational, but we don't feel out of control. What are we trying to do? To soothe our own anxiety, to get past these thoughts, or to hurt and control our partner because we're so enraged? This can be a useful distinction. Some people with BPD report checking out from reality or feeling unreal when they're confronted with triggers and thoughts. Now, retroactive jealousy can have us going into ourselves and dissociating, but again, it feels like it has a purpose. We're engrossed in thought and worry. It's different. What else might suggest BPD? This kind of instability usually shows up in other relationships: friends, family, work colleagues, moving quickly from anger to neediness and despair. Now, retroactive jealousy OCD traits, they show up specifically in our intimate relationships, and specifically around this theme of their past. A feeling of chronic emptiness too, something people with BPD often say they have. Their obsessing feels like it fills that hole. Less so with retroactive jealousy or OCD. We might have chronic doubt or repeating thoughts, but it feels more intrusive than filling a hole. So there's overlap between how we see borderline personality disorder and retroactive jealousy, but there are some clear differences too. And if you do recognize any of this in your experience, this intense emotional reactivity that's pervasive across other relationships, here's where a diagnosis of BPD can be helpful, because it tells you and your doctor and your therapist that we need to work on emotional regulation first. Until we've got ways to ride out that intense wave of distress, nothing else is going to stick therapeutically. And our next priority in therapy would probably be addressing past trauma, because 80 to 90% of people with BPD say they experienced sexual, physical, or emotional abuse in childhood. And usually they were invalidated. They were told or made to feel that their emotions were wrong or bad. With people experiencing retroactive jealousy, I do often work on self-soothing and past trauma, but it's more as part of the process, because they don't have that intense emotionality that absolutely requires that work up front before anything else. Note that there can be a genetic element to BPD too. We might have inherited this emotional sensitivity. It's in the family, but it's trauma or toxicity in early life that activates the BPD reactions and spirals. And another benefit of diagnosis, BPD is treated on the NHS in the UK, and medical insurance often covers it. And talking of treatment, DBT, all these acronyms I know, that's dialectical behaviour therapy, is especially for BPD. And it delivers that emotional regulation work, and it gets really good outcomes. The majority of people with borderline personality disorder can find relief from these very distressing symptoms. They recover. The stats for remission after therapy are really positive. There's stigma attached to BPD. Borderline sounds dodgy, sounds a bit scary. And personality disorder sounds kind of permanent. Yes, people with BPD can be a risk to themselves, and we have to be mindful of this. But there's a lot more hope here than people realise. Borderline personality disorder is estimated to affect 1 to 3% of the general population. And kind of unhelpfully, studies suggest that 15 to 25% of people with BPD also meet the criteria for OCD, which is much higher than the general population. And that's my main point here. These diagnoses and these labels, they only go so far in terms of usefulness. I think of retroactive jealousy as a set of symptoms. The thoughts, the feelings, the reactions that we have to triggers about our partner's past. And it could be due to trauma, OCD, PPD, OCPD, attachment style, or a bit of a combo. See my video about retroactive jealousy and OCPD, because that's not uncommon. But if there's that intensely emotional, out of control reactivity, then that's what we need to address first. And the BPD diagnosis route is good for that. This is all my take on it as a psychotherapist who works with anxiety, OCD, and retroactive jealousy. I'm not in the diagnosis business, so you'd go to your doctor to talk about that. But I hope this gives you some helpful clarity about what might or might not be underlying retroactive jealousy. Thank you for watching.